us more about your visit to Thailand. So why you've chosen Thailand for your Asia tour?
So I chair the Global TB Caucus, which is an alliance of parliamentarians around the world, and we are dedicated to fighting TB. And we work in a large number of countries around the world, 161 countries. But we've never had a TB caucus of parliamentarians in Thailand. TB is an issue that a lot of people in Western countries don't really understand is still a big problem. 1.25 million people a year lose their lives from tuberculosis. So that's obviously a huge number. And this is because we don't have effective prevention and control programs in every country. We do in Thailand, but there is still an issue with TB. There are some 13,000 deaths a year, and about a quarter of those are from drug-resistant TB. And that is very serious, and it's a condition that can be passed on to others. And so it's important that we continue to bear down on these numbers and reduce the deaths. And if you think about it, that's 35 deaths a day here in Thailand. And that's nothing like the kind of mortality we see in very high burden countries in the region, so Indonesia, for instance. But it's still not insignificant. So there is work still to do. And that's why I was very keen to come to Thailand to learn about the great progress that has been made here, but also to talk about the opportunity to continue to reduce the burden.
So since you have been talking to parliamentarians and medical experts here in Thailand, so what have you suggested to these people in order to tackle this problem?
I'm here to learn, but also to offer support. And one of the things that we're able to do as a global network is to pool our resources to share what we've learned from other countries. So I have just come from Manila, where there was a convening of the Stop TB Partnership Board, and they are stepping up their TB control program in the Philippines. And before that, I was in Hanoi, where also Vietnam has been stepping up its efforts, and I visited their central hospital and talked to clinicians and so on. So this is all about learning about what is going on, but it's about informing parliamentarians. Parliamentarians are not the experts, but they are very important people because they take the decisions and they pass the laws and they decide on resources and they influence governments. And this is an important time here in Thailand because the government has to take a decision about supporting once again the Global Fund. And the Global Fund is the international body that provides the resources to fight TB, malaria, and HIV/AIDS. And without it, we could not fight TB effectively. So we are very much hoping that Thailand will at least renew its commitment of some $6 million to the Global Fund, but also Thailand receives money from the Global Fund. It's important for the work that is done here.
Right, and the key word here is partnership and collaboration. So what has the UK and Thailand been doing so far to tackle these health issues, especially on TB?
Yes, I mean, the UK and Thailand this year are celebrating 170 years of diplomatic relations. And actually our health partnership is one of our long-standing collaboration areas under our strategic partnership. The Global Fund, which is one of the significant mechanisms for raising financial support for TB, is effectively essential for investing in the future of diagnostics and case treatments and also detection. So the UK and Thailand together are contributors to that fund, and we collaborate in international fora on these health issues among our health policy experts. I think in terms of what we could do more of, I mean, in the face of drug-resistant TB, which is a major factor globally as well as in Thailand, we could be trying to join up our researchers and look to invest in scientific research to look for innovative treatments and also disease surveillance. So those are the real areas that we can do more of.